Hi, my name is Equan. I'm a student here at the College of Pharmacy at Touro University. Today we'll be going over proper garbing techniques, hand hygiene, as well as aseptic technique for sterile compounding when working in the cleaning room. First, let's begin garbing. Always start with the dirtiest areas first. Your shoes. When putting on the shoe covers, make sure you cover the entire shoe, including the laces. As a reminder, you should always wear closed-toe shoes in the clean room. Next, you will put on a hair cover and then a mask. If appropriate, use a cover for your beard as well. Ensure the metal piece on the mask closely conforms to the shape of your nose. Next, you will wash your hands. First, you'll rub both of your hands together, front and back. Then, clean your fingers by an interlacing and interlocking motion, like so. Then place your thumb in your other hand and clean in a rotating fashion. Clean your fingertips by rubbing them against your palm. Lastly, wash all the way up to your wrist. After you are done, rinse and dry your hands thoroughly with non-shedding wipes. Now put on a clean gown and apply an alcohol-based sanitizer to your hand and allow it to dry. When cleaning the hood, fold a sterile wipe into fours. Make sure to only pour alcohol directly onto the wipe and not the working surface. Use the snake pattern to clean the hood from inside to out, making sure to only use one side of the wipe to clean each section of the hood. The order you clean the hood matters. First, start with the ceiling, then the back, followed by the sides, the pull, and lastly, the working surface. After hood cleaning is complete, sterilize your gloves again with alcohol. Remember that you must clean the working surface again prior to each compounding procedure. So now that the hood is clean, we'll talk about the tools you'll be using. First is the syringe. Notice how it is packaged and sterile. When you open up the syringe, you'll notice a few things about it. The tip, the barrel, the plunger, and the volume markings. It is important that you do not touch the tip and the plunger at any time. These are called critical areas and are the two most likely areas to contaminate the solution you're making. Next is the needle. To assemble the syringe and the needle together, open up the needle partially and attach them together by the lower lock mechanism. Only assemble the syringe when you're ready to puncture the vial. When setting up your working space, it is important to place all items at least 6 inches inside the hood and at least 6 inches away from the back filter. This ensures that the clean airflow is consistent throughout. First, we'll show you how to do a liquid-to-liquid transfer. You will need when you place the items in the hood, make sure they are side by side so that the airflow is not obstructed, and make sure the ports of the bags are all facing the filter. To begin, remove the caps on all vials and wipe the ports of each item with alcohol. Then assemble the syringe, leaving the needle cap on the needle. Pull the plunger back to fill the syringe with the same amount of air as the amount of solution you wish to draw up, in this case, 5 mL. Now that your syringe is assembled, remove the needle cap and puncture the port with the needle bevel sight up at a 45-degree angle, as shown here. Inject part of the air into the vial. This will equalize the pressure inside and out. Don't attempt to push all the air in at once if it's a large amount. Notice when I hold the vial and syringe, my fingers are still spaced apart to avoid blocking the airflow across the needle. Pull back on the plunger and drop 5 mL into the syringe. Lastly, draw up the solution and inject it into the IV bag. Next, you will make an IV antibiotics bag by reconstituting an antibiotics powder. For this, you will need remove the caps from each vial, then wipe them off with alcohol pads like we did in the previous preparation. Assemble a new syringe. Since this preparation needs 10 mL of water to reconstitute the solution, withdraw that amount of air into the syringe. Then puncture the sterile water vial with the needle bevel side up at a 45-degree angle and withdraw 10 mL. Inject 10 mL into the antibiotics bottle, but make sure to also draw up that much air to keep the pressure equalized. Shake the vial until all powder has been dissolved. Now take a new needle and connect it to your syringe and draw up the antibiotic solution and inject it into the IV bag. Lastly, you will learn how to work with ampules. You will need as before, wipe off all the ports with alcohol swabs. Holding the ampule up, put pressure on the neck of the ampule, facing the force away from you, and break the top off. Now withdraw the contents of your ampule into your syringe. Although you cannot visually see it, there may be small shards of glass in the solution, so it is important that you use a filter needle when injecting into the IV bag. Remember, if you use a regular needle to draw up the solution, you want to switch to a filter needle. Or if you use a filter needle to draw up the solution, switch to a regular needle. Do not use the same needle twice. So now you've learned how to perform stereo techniques. We will assess your proficiency by two methods. First, we'll use the paddle test to assess your garbing technique. And second, we'll use a growth media test to assess your transfer technique. I hope this video has been very helpful and informative to you. Thank you for watching, and goodbye.